Gentleman from Pennsylvania reserves. Without objection, the gentlewoman from Washington is designated for the time and is recognized.
Thank you. I yield 3 minutes to the lead sponsor of this legislation, to the gentleman from Connecticut, Congressman Courtney.
The gentleman from Connecticut is recognized.
Thank you, Congresswoman Del Bene, for your leadership managing this bill, and for the Ways and Means Committee for embracing it. Their advocacy sends a powerful message to the House to pass the Middle Class Health Benefits Tax Repeal Act. I also want to thank my friend, Representative Mike Kelly, for his bipartisan support of the bill, defying the polarized politics that too often dominates the health care debate. Madam Speaker, this bill today comes with the support of more than 660 health care groups representing millions of Americans who have joined together to repeal the 40% excise tax on health plans scheduled to go into effect in 2022. Madam Speaker, this tax was a late add-on to the Affordable Care Act deliberations and has been rattling around inoperable in the federal tax code since 2010, never actually having collected a penny of revenue, but nonetheless casting a statutory shadow over 180 million Americans' health plans, which we know in real life from HR administrators and employee reps has added pressure to shift coverage into higher deductible plans, which falls on the backs of working Americans. As the Commonwealth Fund recently reported, the number of Americans who are underinsured as a result of high deductibles has grown by over 50% since 2005. Kaiser Family Foundation just reported that 31% of employer health plans will get hit by the excise tax in 2022, and that number will skyrocket soon after. Passage of this bill will lift the shadow that overhangs employer-sponsored plans and stop the high deductible trend from worsening. As the bill's lead sponsor, I want to foot stomp that the repeal of the tax does not touch the architecture of the ACA's patient protections. Repeal is completely severable from the other 440 sections of the law and leaves intact essential health benefits and the elimination of pre-existing condition exclusions and lifetime limits. Given that those patient protections have been in full operation for the last 10 years, while this zombie tax has been in a coma during that time, it is abundantly clear that the tax is disconnected from the rest of the law. Lastly, I want to underscore the CBO determination that passage will not result in any increase in the number of uninsured. Madam Speaker, with 370 House co-sponsors, I am hopeful that an overwhelming tally tonight will send a laser-like message to the Senate to adopt this bill as soon as possible, as is. And I would ask permission to enter for the record a letter from Families USA, a strong advocate for the ACA, as well as the Council of Insurance Agents and Brokers in support of the bill, and a 2009 letter signed by, again, 188 supporters of the ACA, dated 2009, again, in support of this issue to repeal the excise tax.
Without objection.
Thank you, and I yield back.
The gentleman from Connecticut yields back. The gentlewoman from Washington reserves. The gentleman